Hello, my name is Casimir Banks, and today the disease that I'm talking about is AIDS, which is acquired immunodeficiency syndrome. So, before I start, I want to tell you that you cannot get AIDS without having HIV. There's no way. AIDS and HIV work hand in hand. They are not the same disease, but they are very, very similar. HIV leads to AIDS. So you'll hear me talking about HIV a lot in this presentation because they work hand in hand. So what is HIV? HIV is human-acquired immunodeficiency virus, and it is a type of RNA virus with two subtypes, HIV-1 and HIV-2, with HIV-1 showing global distribution and HIV-2 being prevalent mainly in West Africa. HIV attacks cells that help the body fight infection, making a person more vulnerable to other infections and diseases. HIV is spread by contact with certain bodily fluids of a person with HIV, most commonly during unprotected sex or through sharing injection drug equipment. However, by taking HIV medicine called antiretroviral therapy, people with HIV can live long and healthy lives and prevent transmitting HIV to their sexual partners. In the U.S., most people with HIV do not develop AIDS because taking HIV medicine every day as prescribed stops the progression of the disease. The only way you know for sure if you have HIV is to get tested, and if left untreated, HIV can lead to the disease AIDS. Now, what is AIDS? AIDS is the late stage of HIV infection that occurs when the body immune system is badly damaged because of the virus. AIDS is the disease caused by the damage that HIV does to your immune system. You have AIDS when you get dangerous infections or have super low number of CD4 cells. AIDS is the most serious stage of HIV, and it leads to death over time. HIV continues to be a major global public health issue, having claimed 36.3 million lives so far. There is no cure for HIV infection. However, with increasing access to effective HIV prevention, diagnostic, treatment, and care, including for opportunistic infections, HIV infection have become a manageable chronic health condition, enabling people living with HIV to lead long and healthy lives. There were an estimated of 37.7 million people living with HIV at the end of 2020, over 2/3 of whom, which is 25.4 million, are in the WHO Africa region. So as you can see, this disease is very common. So as I stated in the beginning, HIV and AIDS is a disease that lowers your CD4 T count. And CD4 T is what I'm about to talk about now. So CD4 plus helper T cells, are T cells that are white blood cells that fight against infections. They play an important role in our immune system. CD4 cells help coordinate the immune system response by stimulating other immune cells to fight against infection. So, examples of them will be macrophages, B lymphocytes or B cells, CD8 cells, etc. Now, on the side, this is a picture of how the CD4 T cells are damaged by HIV infection. So, I'm just going to explain it a little to you. The cycle. So, first, HIV attaches to and it penetrates host T cells, then releases HIV RNA and enzymes into the host cell. HIV reverse transcriptase copies viral RNA as proviral DNA. Proviral DNA enters the host cell's nucleus, and HIV integrase facilitates the proviral DNA's integration into the host cell's DNA. The host cell then produces HIV RNA and proteins. HIV proteins are assembled into HIV variants and budded from the cell surface. HIV protease cleaves viral proteins, converting the immature virion to a mature infectious virus. So that's what's happening in this picture on the right. So the progression of HIV. HIV has 3 stages, and the last stage, which I will be talking about, will be AIDS, but I'm going to tell you how all 3 of the stages progresses into AIDS. So, the first stage is the acute stage. People have a large amount of HIV in their blood. They are very contagious. Some people may have flu-like symptoms, and some may not feel sick at all. And this is the acute stage. Stage 2 is the chronic stage, and also called the asymptomatic HIV or clinical latency. HIV is still active but produces at very low levels. People may not have symptoms or get sick during this stage without taking HIV medicine. This period may last a decade or longer, but some may progress faster and still can transmit this in this phase. At the end of this phase, the amount of HIV in the blood, called viral load, goes up and the CD4 cell count goes down. The person may have symptoms as the virus levels increase in the body, and the person moves into stage 3. So stage 3 is AIDS. So AIDS is the most severe phase of HIV infection. People with AIDS have such badly damaged immune systems that they get an increasing number of severe illnesses called opportunistic infections. People receive an AIDS diagnosis when their CD4 cell count drops below 200 cells per cubic milliliter, or if they develop certain opportunistic infections. People with AIDS can have a high viral load and be very infectious. Without treatment, people with AIDS typically survive about 3 years. So that's not very long at all. Symptoms of AIDS. Symptoms of AIDS can include rapid weight loss, recurring fever or profuse night sweats, extreme tiredness, prolonged swelling of the lymph glands in the armpits, groin, or neck, diarrhea that lasts for more than a week, sores of the mouth, anus, or genitals, pneumonia, red, brown, pink, or purplish blotches under the skin or inside the mouth, nose, or eyelids, memory loss, depression, and other neurologic disorders. In this picture on the right, it's just showing basically what it said over here. Night sweats, swollen lymph nodes, mouth flares, that's the mouth sores, fevers, rash, muscle aches, chills, and fatigue. A person with HIV is considered to have AIDS when the number of CD4 T cells fall below 200 cells per cubic milliliter of blood, or they develop one or more opportunistic infections regardless of their CD4 count, which I just mentioned previously, but I just think this is very important because this is what the virus is. This picture on the left side is a healthy human T cell, and this one on the right is the HIV-infected CD4 cell. So effects on exercise. Generally, people with AIDS do not require any special types of exercise. However, certain physical activities such as resistance training can help prevent the loss of muscle mass and strength, which occurs in some people living with AIDS. There's also a connection between muscle mass and immune function. People who exercise often have higher CD4 counts and fewer side effects from AIDS and its drugs. Management and meds. So there is no cure for AIDS. The management is focused on maintenance of function. The treatment of AIDS with medicine is called antiretroviral therapy, which I mentioned previously. An abbreviation is ART. It is recommended for everyone who have HIV or AIDS. The medicines do not cure HIV infection, but they do make it a manageable chronic condition. They also reduce the risk of spreading the virus to others. Without treatment, it usually takes about 10 years for someone with HIV to develop AIDS. A person's initial HIV treatment regimen generally includes 3 HIV medicines from at least 2 different HIV drug classes, such as NRTIs, NNRTIs, PIs, fusion inhibitors, CCR5 antagonists. NRTIs is a block reverse transcriptase and is an enzyme that needs to make copies, the HIV needs to make copies of itself. NRTIs bind to and later alter reverse transcriptase. PIs block HIV protease and enzyme HIV needs to make copies of itself also. Fusion inhibitors block HIV from entering the CD4 T lymphocyte of the immune system. And CCR5 antagonists, they just block the CCR5 receptors on the surface of certain immune cells that HIV needs to enter the cell. So that's just a little insight on some of the medications that are taken for HIV and AIDS. There's many more, but there were a few that I just touched base on. So the case study. An 18-year-old client who just developed AIDS is currently taking antiretroviral medication, and protease inhibitors to slow the progression of the disease. Her blood pressure readings and blood glucose levels fall into healthy ranges. Her BMI is 26.6. She's been on this medication for about 6 months and have been experiencing lipid dystrophy. She gained 15 pounds in the last 6 months and wants a workout plan to help her lose weight and decrease the side effects that she is experiencing from these medications. How would you proceed with this client? So, for exercise testing, I would do the Boost Protocol stress test or a 6-minute walk test. The 6-minute walk test is a sub-max exercise test used to assess aerobic capacity and endurance. And the Boost Protocol stress test is a standard test in cardiology comprising multiple exercise stages of 3 minutes each. At each stage, the gradient of the treadmill are elevated to increase the workout. It is a standardized multi-stage treadmill test for assessing cardiovascular health. Boost Protocol stress test is usually a little bit harder for some people, so 6-minute walk test is very easy. It's like it's not as intense. So either or. And I will give this to this patient because usually people with AIDS are basically considered healthy individuals because they don't need to really modify their exercise prescription. So for the exercise prescription, for the aerobic, I did the frequency daily includes vigorous intensity at least 3 days a week, intensity moderate to vigorous, time less than or equal to 60 minutes a day, type bicycling, running, or jumping rope. For resistance, frequency at least 3 days a week, intensity 8 to 15 sub-max repetitions of exercise until moderate fatigue with good mechanical form, time less than or equal to 60 minutes, type push-ups, lifting, weights, resistance bands. For flexibility, frequency I did at least 3 days a week, intensity stretching until feeling slight discomfort, time hold for 15 to 30 seconds, type dynamic, static, and PNF stretching. Since this person is 18 and considered an adolescent, I just added bone strengthening to her exercise prescription, so the frequency will be at least 3 days a week. Intensity will vary with emphasis on activities that produce moderate up-high bone loading through impact or muscle force production. Time less than or equal to 60 minutes. Type runner and jumping rope or resistance training. So, in conclusion, I just want you guys to know that AIDS is a late stage of HIV infection that occurs when the body immune system is badly damaged because of the virus. A person with HIV is considered to have progressed AIDS, progress to AIDS when the number of their CD4 cells fall below 200 cells per cubic millimeter of blood, or they develop one or more opportunistic infections regardless of their CD4 count. Heard me saying this multiple times because I feel like this is the most important thing. With proper treatment of HIV/AIDS, many people can expect normal or near normal lifespans. So this is a disease that can be controlled with proper medication. You just have to be on top of it. And these are the references. That is all.